Now to some help in beating the heat as that intensive heat wave settles in. It's important to know when it can turn into a life-threatening situation. And joining us is ABC News medical correspondent Dr. Darien Sutton. Thanks for being with us. So Dr. Sutton, people can find themselves dealing with heat exhaustion and the more serious heat stroke. So help us understand the difference.
Yeah, well, Janae, there's nearly more than at least 130,000 emergency room visits each and every year. That's likely an underestimate, as ER doctors, myself included, see many of the complications: high blood pressure, heart failure, severe dehydration. So important to pay attention to those first symptoms of heat exhaustion. That's when your body's internal thermostat begins to have difficulty maintaining temperatures on these hot days. And it can present as headache or dizziness, as our brains are very sensitive to even small changes in temperature, and profuse sweating and thirst. But as your body's thermostat begins to have failure, that leads into heat stroke, and that's what we call end organ damage. And the reason why that happens, or one of the main reasons, is because blood rushes to our skin. That causes us to feel flushed, but that leads blood away from our vital organs, our brain, our heart, and our kidneys, and that is what leads to the complications. And sometimes you can see sweating, but as I was discussing during the break, for some patients, sweating has stopped because dehydration has begun so severe that then patients present with hot, dry skin. All of these symptoms you have to pay attention to as an emergency.
Yeah, that's an emergency. Call 911.
Absolutely.
But what can you do in the meantime?
Yeah, well, call 911, number one. Wet clothing, evaporative heat, so you want to get some fans, and that helps to get the heat off of that patient. And then you want to place ice packs like an ER doctor. We normally place them on the forehead. You want to place them near the biggest blood vessels, the neck, the armpits, the groin. That's when you're having that emergency. That's when you get that person out of the heat, and of course you call 911. And
that's how to treat heat stroke, but how do you prevent it in the first place?
You know, paying attention. We talk about the weather reports, and I think it's so vital because when you see that heat index creep above 90, Samara was talking about feeling like it's 115 degrees. Above 90, when it starts to feel like that, that's when that humidity rises. That's when our sweat response stops working because sweat doesn't evaporate, and then that is what leads people to having increased risk of heat stroke. You want to make sure to pay attention to cooling centers. Check on our grandparents especially. They can be especially susceptible to heat stroke, those who are pregnant, and then more importantly, those who are on medications. Many people do not realize that that can tamper with your internal thermostat, exposing you to at risk. So blood pressure medications as well as antidepressants, all of these medications can increase your risk. Number one importance, being aware and making sure that you're prepared.
Such important information, especially when we're in this long stretch of heat like we're dealing with right now.
Absolutely.
Dr. Darien, as always, appreciate it.